This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code My DPC Story. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care to me is freedom and salvation for physicians, and it is the solution to a crappy, broken system for patients. It allows me to take care of patients the way they deserve to be taken care of, unencumbered by the tyranny and oppression of corporate medicine and the insurance companies. And it allows my patients to have access to a physician who really has their best interest in mind. I'm Dr. Kyle Adams of Auburn DPC, and this is My DPC Story.
Dr. Kyle Adams is a board-certified family medicine physician. Originally from Leesburg, Georgia, he graduated with a Bachelor of Science degree from Georgia Southern University. He attended medical school and received his MD from Mercer University School of Medicine in Macon, Georgia. After medical school, Dr. Adams completed a year-long internship in OB-GYN at Mercer University Navicent Health in Macon, Georgia, and then went on to complete family medicine residency at Wake Forest Baptist Health in Winston-Salem, North Carolina. He married his high school sweetheart, Lane, in 2011, and they now live in Auburn with their 3 kids. Dr. Adams enjoys powerlifting and anything outdoors, but he often gets made fun of for his lack of football knowledge. In his professional career, Dr. Adams enjoys getting to know his patients and spending time helping them learn to lead a healthy and active lifestyle. He also enjoys procedures and offers them for free to Auburn DPC patients. He opened Auburn Direct Primary Care in March of 2021. I wanted to start by reading a quote that you had written in a blog post right as you were opening Auburn DPC. And so the quote is, "Doctors in the mainstream fee-for-service world are not truly working for their patients. They're working for the insurance companies who will do anything in their power to refuse coverage or at least pay less than what a service is worth. Because of the huge financial and time constraints placed on these doctors, they are forced to see 20 to 30 patients per day, spend hours on documentation, and carry patient panels of 2,000 to 3,000 patients each. Don't get me wrong, these are not bad doctors. These are good doctors trapped in a bad system. So I decided to step outside of that broken system and do something different. In my practice, I can accept whoever I want, even the tough and time-consuming cases. I can take text messages from patients since I don't have to force them to come into the office to get paid. I can spend time on educating my patients, listening to their concerns, and treating them as a whole person. And I can do it all without putting my patients into debt over their health care. So with that, welcome to the podcast, Dr. Adams.
Thank you very much.
When I saw that quote, are those lines of your, your story on your website, on your blog. I love that you've pinned it to your Facebook page. So it's, prominently there for anybody to see, because, some of the posts on the responses to your blog posts are people who are like, this is a scam. This is not real. And so, I love that you are embodying in your website and in your community now what it truly means to be a direct primary care doctor.
So as you mentioned, I pinned that to the top of my Facebook page because I think that particular article kind of encapsulates everything that I'm trying to do here. And I want anybody who's interested in our practice and in me as a physician to be able to have access to that information and really understand what we're trying to get done.
And prove that it's not a scam.
And it's not a scam. Yeah. It's the real deal. And I still get patients almost every day in here that we see for the first time who leave or are on their way out the door and say, I can't believe that this is actually a thing, that y'all are actually doing what you're doing here. And people just love it.
Absolutely. And definitely that's something that I know for me, it fills my cup every single time I hear that. I heard that from a patient yesterday when I did a home visit. She's like, I slept better. That's because you listened. And I was like, that's amazing. I'm glad you slept better. So let me ask you, when your focus is quality over quantity, I want to ask about what was it that led you to even choosing this path in your career of medicine?
Well, I think if anybody's read that particular article, then they've got a decent idea of what it was that led me to this. But I had been employed as chief medical officer of a growing urgent care chain here in Alabama, and I was overseeing 9 and then towards the end of it, 10 clinics, and led that company medically through the entirety of 2020, which was, as you can imagine, a ton of fun. And toward the end of that, I kind of looked around and realized that I had become a COVID testing technician. And that is not what I wanted to do with my medical license. So I decided to become a real doctor again. And toward November of 2020, I was on an urgent care shift and I established my LLC on my cell phone between patients. And then I put in my notice the next month, and the following March 1st, we opened. And, it's been the best decision professionally that I think I've ever made.
Incredible. And I love that. I hope that, other people got a kick out of that as well, just because, this is something that is real. It's something achievable, and, just developing your LLC and, establishing it between patients is one way to prove that. So that's amazing. Now, one of the, big questions that people have when they're thinking about this model, and I just had a conversation with a local doctor about this, is the fear of jumping in because of the finances being so different. Yep. So I want to ask, when you were going, in your mind from, being a CMO, being a COVID technician, so to speak, as you just said, to becoming a real doctor again, what were some of those fears and how did you overcome them financially when you transitioned to DPC?
Like anybody else, of course, I was worried about it. I finished residency in 2017, so it's not like I had a huge stockpile of money sitting around. And I've got a family of 5 to take care of. And so that was one of my major concerns was how am I going to make money? How am I going to keep my family fed and pay off these student loans? So I've always kind of been the kind of person who, once I get an idea in my head, it's probably going to happen one way or the other. And through my experience in urgent care, I was pretty familiar with how locum tenens work goes. And so I thought, I'm a family medicine MD. If I need money, I can find a shift tomorrow somewhere. So there was really nothing concrete holding me back from doing it, because I knew that if it came down to it, I could make money. If you've got an MD or a DO, you can make money. And so I decided to do it. And I just jumped in, and I kept my side gig, which the urgent care became the side gig for quite a while, until the DPC practice was really making a little bit of money for us. And I still actually serve kind of in an advisory capacity for that company, but I'm no longer working urgent care shifts, and I go home at 5:00 every day.
Spoken like a true doctor entrepreneur. So I absolutely love that. And one of the things that I had learned about you just through research before our talk today is that you also have successfully paid off your student loans. So please share about how you are a doctor on fire for the people, familiar with that terminology.
Yeah. Now, my wife told me not to talk too much during this interview, so you may not want me on that topic. But yeah, I started getting interested in personal finance and the concept of FIRE, financial independence, at some point in medical school, after I had already racked up a ton of debt, of course. And I kind of carried that mentality with me through residency and into my early medical career. And so when I finished residency, I had around $360,000 in debt. And that was in November of 2017. And so my number one goal coming out financially was to get that squashed. Mm-hmm. So and thankfully my wonderful wife was completely on board with that. So we did not go and buy a doctor's mansion. We did not buy BMWs. I'm still driving a Ford Focus, which is fine. So basically every spare penny I had went to paying off those student loans. And so we finally got it done, and it's a huge relief.
A huge relief. And with your kids being so little and with you guys being so young, this is just, congratulations. It is not an easy achievement, but you've worked your tail off to do that. So congratulations. It's amazing.
Thank you. Yeah, there's a lot to be said for financial freedom. And of course I'm not completely there yet, because I do still have to work for money. But I don't have to work as much as I am working.
Yeah. And you're not, digging yourself out of that hole as like you were before. So definitely words to take to heart. And for those people who aren't, familiar with the FIRE movement, just Google it and you can find out a ton more. Just stopping there, do you have any resources that you really latched onto when you were learning about the FIRE movement?
Oh, absolutely. So Mr. Money Mustache is kind of my man crush. And if I can encourage anybody to read any blog article, my favorite blog article of all time is The Shockingly Simple Math Behind Early Retirement on the Mr. Money Mustache blog. And that one really opened my eyes to the power of frugality and saving and what you could really do and what kind of freedom you could buy with that. So Mr. Money Mustache is a big one. Physician on Fire is a great one that's targeted specifically to doctors and other traditionally high-income individuals. And then the White Coat Investor is awesome. That's Dr. Jim Dolly, I believe, an emergency physician. And he comes at things from a little bit different angle. He's not totally on the FIRE train, but his financial advice is super sound. And it was one of the first financial books I ever read.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. Wow. Definitely great resources. And thank you for mentioning those. Now, as we talk about finances, you have a physical space for your clinic. So can you tell the audience about how you worked finding a space into your budget, and how did you actually transition from being in your former, work to being at Auburn DPC?
Sure. So real estate was actually fairly hard to come by. That was the most challenging, honestly, piece of putting this business together, was finding a place to do it. And I kind of knew right off the bat that I did not want to go the straight up micro practice route. I didn't want to do everything myself because I hate paperwork and I hate answering phones. So it's awesome to have somebody doing that for me. But I contacted a commercial real estate agent here in Auburn, and he was able to show me around this place, and it just happened to be perfect. I mean, it just came together. This place was available right when we needed it, and it's I've got my office room right here, right next door is my one exam room, and then I've got a nice big lobby. And I've got a little kitchenette, and there's a storage room that had all this built-in shelving and these cabinets, which is perfect for a supply room and pharmacy.
Nice.
So it was kind of serendipitous there. So we jumped on this one.
Awesome. And in terms of transitioning, did you take some time off between jobs, or did you overlap the two? How did you do the transition?
Yeah. So in early 2021, I was still working like 3 shifts a week at the urgent care. I had stepped down from the CMO role, but I was still working shifts to pay the bills and to accumulate a little startup fund for this business. So, working 3 shifts a week, I still had a pretty significant chunk of time to be over here, getting things set up, setting up the space and ordering what I needed to order and putting furniture together. And this whole clinic is thanks to Amazon. I mean, like everything we got in here is from Amazon.
That's amazing. And so now a big question, because in Auburn, there was no DPC before Auburn DPC opened. And so right. I want to ask, as you made that transition, you have your clinic, you have all your Amazon orders, set up. How did you open? What was your experience with opening day? Had you done a wait list beforehand? Did you do marketing pre-opening day? How did it work for you?
Yeah. So prior to this, I had 0 business experience, 0 marketing experience, had no idea what I was doing. So I really just kind of dove into the DPC Docs Facebook group and ate up every DPC resource I could find. I read Paul Thomas's book, which was great. So big shout out to Paul Thomas for that. And I decided to start with Facebook advertising. And I didn't even know that you could run an ad outside of your actual just boosting a post. So I just started up the Facebook page for the business, and I boosted a few posts and did my best to kind of explain what it was in a tiny little square. And anytime I encountered a patient on one of my urgent care shifts that needed a primary care doc, I would kind of slip them a card and say, "Hey, here's what I got coming up. If you're interested, I'll put you on a little wait list." And I wound up having, I think, 8 or 10 patients pre-enrolled. But I had a patient at 9 a.m. when we opened on March 1st. And he's still with me.
Wonderful. That's so cool. And I do appreciate you sharing those numbers too, just because, there are amazing examples. Like I don't know how Dr. Kissy Blackwell did her 278 waiting list on day one.
That's incredible.
It's incredible. But I will say that, for people who might be new to a community, if they've moved somewhere where they didn't train or they haven't been practicing, hearing, 8 to 10 on day one, that's definitely a number that doesn't sticker shock people. And also gives, a realistic number in terms of like what finances could you expect. So I want to ask there, did you have a pre-enrollment sign up fee so that you had some money on opening day as well?
Nope. I've never done an enrollment fee because I think that scares patients off a lot of times. So the way we work it is your first month's membership dues are due up front. They're due upon enrollment in order to schedule your first appointment. That's got to be paid. That covers you for the rest of the calendar month. And so everything is paid in advance. And that way, if you see somebody and then they never come back again, at least you were paid something for your time that you spent at that first visit.
Absolutely. And so important. I mean, I remember Dr. Van Slassy in his podcast talked about how he took a patient for a one-off visit and it ended up being a really, significant pathology finding, and the patient had to get a significant workup and he didn't really get paid for the time that he invested. So I totally hear that. And now, over a year later is when we're doing this recording, you are in a very different position patient number wise, and you still have not opted out of Medicare. And so I want to ask when you talk about that, you didn't know, you hadn't been trained in business and marketing, but yet here you are with more than 300 patients now. How did you continue to, get the community exposed to DPC, understand DPC, and how did you grow your practice?
Yeah. So I will mention right off the bat, you mentioned Medicare, and I actually did just complete my opt-out like 3 weeks ago or something like that. And we've already gotten like 5 Medicare patients. So that's definitely needed in our community. And I was finally able to get that done. But as far as how did we get the word out? How did we grow? There were several different avenues that I took. One of the things was I did my best to reach out to as many non-traditional groups as I possibly could, and really try to talk to people that a lot of times doctors are not actively pursuing. Right. Mm-hmm. So one of my goals for Auburn DPC is to really be LGBTQI affirming and to provide gender affirming care. And if you're not from the South, you've probably heard a story or two about how things tend to be down here, and they're not wrong. So as far as I'm aware, and we talked about this a little before we started recording, I think I'm the only doc between like Atlanta and Birmingham who's offering gender affirming hormone therapy. But that has been a big source of patients for us, and that's not why we do it, but it's it has helped. So I started reaching out, like I said, to the local Pride group. I reached out to an LGBTQ nonprofit out of Selma that we've partnered with to take care of their clients. And of course, I've done some of the more traditional things like going to Chamber of Commerce meetings and just talking about what I'm doing and what DPC is at those places. And then honestly, as far as marketing goes, Facebook is about all I have done. Very recently, I've worked with a marketing agency to try to promote my new virtual primary care track. But prior to 2 weeks ago, it's been just me boosting some Facebook posts. And we've gotten a huge response from that.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. I think it was Dr. Phil Boucher who had mentioned that, the investment was not too much in terms of putting those ads, the independent ads, not just a boosted ad on Facebook, and the return on investment for his practice as well was just incredible. So can you share some of those financials in terms of like, how much do you budget and what do you get to expect from Facebook ads in your community?
Sure. To begin with, I think I was spending like $40-$50 a month on Facebook ads. And toward the end of last year, I wound up increasing to somewhere around $200 a month. And that's about the most I've ever spent on advertising.
And, just with the return on investment there, like Dr. Phil Boucher had said, that's incredible, especially if it's a monthly membership and they are with you for the lifetime of your practice.
Oh, absolutely. It's massive. And not only that, but social media offers so many free opportunities to reach your community members. So in the beginning of last year, I was posting in like the Auburn Opelika What's Happening page and stuff like that. My wife was posting in the local moms groups and stuff like that. And I've gotten a couple of patients from her Moms of Preschoolers group. So, all those things are completely free. And they're legit. They work.
Wonderful. And can you share a little bit more in terms of details as to what your patient panel is like now in terms of, you mentioned how you are providing gender affirming care, but in terms of like demographics, age groups, who's insured, who's not, can you give us a little bit of a picture of who you're taking care of?
Sure. And I don't have any exact numbers to give you because I really just don't track anything like that. But kind of spitballing it off the top of my head, I would say that the majority of our patients are mid-30s to mid-50s. As far as race, socioeconomic status, things like that, we really run the spectrum. I mean, I've got Auburn University professors, I've got business owners, I've got mechanics, I've got people who dig ditches for a living. I've got anybody you can think of. And there are different reasons that these different demographics appreciate DPC and, want to be a part of it.
And you've read my mind in terms of that was my next question. Why do these patients join your practice?
So I would say that the most common thing that I hear is I can't afford healthcare anywhere. I've been living with uncontrolled hypertension and diabetes for the past, 10 years, and I've seen a doctor 3 times. This is incredible. I can't believe that something like this exists. So those are, most often my patients who are lower on the socioeconomic spectrum and have had great difficulty with access to not only healthcare, but good healthcare. Sure. And then, of course, on the opposite end of the spectrum, with my more affluent patients who have Cadillac insurance plans, they're here for the access and the convenience. They want a doc who's going to sit down with them and talk through whatever they want to talk through for an hour and take good care of them and know that I'm a text message away.
Absolutely. And I'm so happy for you that so many people understand what you're doing and have joined your practice. I want to ask, in terms of when you were starting out and growing your panel to what it is today, one of the avatars that is hard for people to convince sometimes, or to help understand the model, is the well young person. Why does a well young person who has insurance need a DPC doctor? What do you have to say to those people?
Well, the first thing I tell them is, my model may not make sense for you. So, I mean, I'm not trying to sell everybody on DPC. I say, here's what we are and what we have to offer. And if it makes sense for you, we'd love to take care of you. But to answer your question more specifically, why do I think that even somebody who's young, relatively healthy, may benefit from DPC? I get phone calls from people every single day who have a problem they've never had before. They've previously been completely healthy, but now they need a doctor and they can't find anybody.
Yeah.
They have called every fee-for-service practice in town, and there's 4 to 6 month wait list. And they're relying on urgent care to try to diagnose these crazy symptoms or whatever it is that they've got going on. And they have no access to care, but I can see them tomorrow.
Yeah.
And, if they had been signed up with me the whole time, then I could have seen them 2 weeks ago.
And you have such a unique perspective just because of your time in urgent care and looking out for, 9 clinics or 9 urgent cares under your wings. It's an incredible perspective to pull from when you're talking to people. And absolutely, I'm hard pressed to think of any community where patients can't relate to those similar stories. Yeah. Now, one thing that I noticed, and I don't know if this is because you just shared, you have recently added this virtual practice, but I want to ask about when you were deciding to incorporate this virtual practice, what was the thought process there, and how have patients utilized that service?
Yeah. So we just started offering this new virtual primary care option, and my thought process there was, we're doing a pretty good job at reaching patients here in Auburn, Opelika, but there are a whole bunch of patients out in the middle of nowhere between here and Birmingham that have no access to care. And, and the same goes between Birmingham and Huntsville, or a lot of these other places around rural Alabama, and even in the cities, where folks don't have access, and we could provide that for them. There's no reason to limit ourselves just to our little 30-mile radius right here. And not only that, but we're getting to the point now to where our schedule's pretty full. We're seeing 6 to 8 patients a day, depending on how many new patients I've got coming in a given week. And especially new in-office patients take up a lot of time. They take up a lot of effort, and not only on myself, but on my everything, Marcy, and I'm not really interested in hiring more staff. So this is a way that we could potentially gain more patients. On my end, gain more business and increase revenue, and on the patient's end, take care of more people without utilizing so many resources and taking up so much time in the clinic. Because if anybody has experienced telemed before, you probably are aware that usually those visits run a little quicker than having somebody sit down in the office and collecting their vitals and chit-chatting about whatever they got going on. When you're on a telemed visit, people tend to get to the point. So things just run a little quicker and a little smoother. So that's kind of my thought process behind offering that membership option.
Wonderful. And yeah, it's so true. And, even just the idea that telemedicine with a DPC model allows also for both synchronous as well as asynchronous care. It definitely allows you to be able to manage your time differently than if you were, in a driven world of you have to be seen in person or virtually in person. You can respond to people's questions by an email or by a portal message where
Absolutely.
It wouldn't be as easy before. So now I want to ask, with regards to your membership, because I saw on your website, I was like, where's his prices? I can't find his prices. So tell me, in terms of if you're able to share the pricing for your membership, as well as how did you come to your pricing?
So I think the pricing is listed there on the website. But for no, it's fine. But for adults, historically, it has been $75 a month, and for kids 0 to 18 or 0 to 17 who sign up with a parent, it's $25, and independent kids are the adult price, $75. We actually just increased our membership prices to $80 for adults and $27 for kids. So I used the 7% inflation rate over the past year to calculate that. And while a $5 increase wasn't quite 7%, I didn't want to go too much more than that. So that's kind of where we landed. And to be honest, I didn't have a great reason to set the prices at that level. But Dr. Shinaloo in Birmingham, who owns Birmingham DPC, was one of the folks that I talked to before opening up, and I went and visited him and checked his practice out before I opened, and those were his prices. So nice. I thought, hey, that looks pretty good. So that's where I'll set mine.
Yeah. That's wonderful. And I love that you've also been able to pivot to adjust for inflation. And yeah, I remember when I was developing my own practice pricing, I was like, well, I know people are going to use their credit cards most likely. So I was like, I'm going to bump up to expect credit card fees right now in my pricing, because you just, I think I got that from Dr. Julie Gunther's book, Spark, Start, Fires, where she spoke about, you think you're going to calculate for your overhead this way, and then add a certain percentage on top of that just to cover your fees, because you never know what to expect. So thank you for sharing. Now, in terms of your numbers, you said you see 6 to 8 a day, and I'm sure some, fee for service doctors or, people in residency who are working in an FQHC type of clinic are just like, what? That's not even real. So, and they're like, is that a quarter of a day or a half a day? So, on that, I want to ask, how do you strategize your schedule on an everyday basis so that you have time for you have time for your family, you have time to manage the practice? How do you do it?
Yeah. So our office is open 9 to 5, Monday through Thursday, and 7 to 12 on Friday. And so when the office closes, I go home. And it's really as simple as that. So as far as in terms of patient scheduling, my office manager usually schedules most patients. And for new patients, we do an hour and 15 minutes. And for established patients, for most visits, we do 30 minutes. And so we just, put them in whenever they want to be seen for the most part. And there's rarely a time when a patient calls and wants to come in on a particular day that we can't accommodate that. And as I mentioned, a lot of this depends on how many new patients I've got coming in on a particular week. And that fluctuates, based on, what time of the year it is, how much we've been advertising, and some other just, factors that I'll never understand, I guess, because some months we might get 30 or 40 new enrollments, and then other months we might get 12. And so in weeks where we've got lots of new patients coming in, we're a lot busier, and those are more of like the 8 patient, sometimes 9 patient days. But if we haven't had that many, then it may be more like 4 to 6 patients. And that leaves me plenty of time to fill prescriptions, to take care of business stuff, to answer emails, answer text messages. I really haven't come up with any issues as far as time goes for all those things.
Wonderful. And you talk about that you are still accepting new patients. So what's your ideal panel size that you envision for Auburn DPC?
I don't know for sure. I'm not much of a planner. I'm kind of like, we'll know when we get there. I think, like I mentioned, we're starting to feel a little busier, and Marcy is definitely starting to feel the pressure as the phone's ringing more often. And especially as our kind of organic SEO has improved over time, and people are just seeing us on Google when they are looking for PCPs. That has really increased the phone traffic. And so, Marcy's feeling that pressure. And of course, I'm feeling the pressure of seeing more patients and responding to more messages and things like that. And I figure that here pretty soon, we'll probably just come to a point where we're like, you know what, this is enough, and we'll stop.
Yeah. Yeah. And, just as a dad of 3 young kids, before we started the recording, I'm just like, I want to know how you do it, because you have one more child than I do. And I'm just like, wow, he's doing it with 300 is what I ideally is my full panel size. So I would love if you have any, things to think about for parents who are potentially with young children or who are going to expect young children in the future who are thinking about DPC.
First off is have an awesome spouse or partner of some kind, because that is how it works for me. My wife Lane is incredible, and she stays home definitely with our youngest 2 all the time. And my boy is in preschool 5 days out of the week, but that's only like a half day. So sure. She kind of handles everything at home when I'm not there, which is awesome. But as far as making sure that I've got enough time to spend with them, again, it goes back to at 5 o'clock we close. So we don't have visits after that. If patients call and want something that we don't offer, my work schedule doesn't. I don't get off work until 6 o'clock. Can you do visits after 6? Well, the answer is no, because that's when I'm with my family, right? So it's setting those boundaries and sticking to them.
Yeah, absolutely. Boundaries is a very good word to be familiar with and to love in entrepreneurship for sure. And I love that even when you said, and I go home, like there was no, hesitancy there. It was like, that's the end of the sentence. I can't see you at 6 because I go home at 5. So yeah. I absolutely love that. And I think it's so important for people to hear that, because setting boundaries early is definitely something that, people lament on a lot about on the DPC doctors Facebook groups and whatnot about like, this, how am I supposed to control the texting or, whatever it is. And so really envisioning your practice as you go into the future, reevaluating periodically to say like, am I happy with this? How do I pivot if I'm not? It's really important to hear those words.
Absolutely. Of course, I'll get text messages after hours and emails, and my phone will ring, which I never answer. I let it go to voicemail. And if it's an emergency, I'll call them back. But as far as text messages and things like that go, if it's after hours, I'll look at it. If it is an emergency, I'll respond. If it must be responded to, then I'll respond. And if not, I'll respond when we open. So if it's, Friday at 1:00 p.m., we're closed. You're going to get a response on Monday. And if patients aren't satisfied with that, then this may not be the practice for them. And I really think that's how most docs should look at it, because I think most DPC docs are going to provide excellent value for their patients, and they're going to take really good care of their people. And, if there are particular patients who don't see that, then DPC may not be for them. Sure.
And just like you're saying, DPC is not for all patients. The same thing with physicians who are looking at this movement. One of the other pieces of copy that I had read on your website, when you talk about texting, it made me think about this, is you had written, included with membership is free telemedicine visits, free procedures, free in-house labs. So I would love to hear in terms of the mindset that you were in when that copy was made. Some people say included, but I love, I was like, oh, he literally said free, because it is included. And that's another way to say it. So how did you, eventually get to that copy specifically, and had you changed it over time?
I don't think I've ever changed it. I think I started with that phrasing. And anytime I'm putting any media together or advertisement, or when I was writing all the copy for the website, my thought is always I'll write it and then I'll try to read it as a patient and think like, what would make me want to buy this? You know what I mean? I mean, from a business standpoint, you have to do that. You have to look at this as a business. And people like to get things for free. People don't like to get things included. They want something for free. So, using that terminology, I think is just a little teeny tiny mind trick.
I love it. It's like the nines. The idea that it's 139 versus 140. It definitely makes an impact. So now with regards to the procedures that you provide free with your members, what types of procedures do you provide?
I think probably just your run-of-the-mill primary care stuff. So a lot of skin procedures, cyst excisions, INDs, suturing, toenails, toenail removals, things like that, biopsies, punches, shaves, excisions, pap smears. Of course, I don't charge anything to perform the pap, but the lab charges to analyze that and give us a result. So I'll make sure patients are aware of that up front. I'm trying to think of what other procedure, foreign body removals, pulling bugs out of people's ears and stuff like that. Nothing crazy, nothing special, nothing that requires an OR or anything like that. But I try to do as much as I can here in house.
Awesome. And that's the care that your patients value, is like you're doing as much as you can, and giving them that service at a great rate for them. So that's amazing. Now, I want to ask about your in-house pharmacy. You do stock medicines. Did you add on as more patients were needing particular medications?
Yes to both. So I kind of put together an initial inventory with what I thought I would need. And I've just adjusted that over time, and mostly adjusting means expanding. So I've added a ton of stuff that I didn't anticipate needing at first. My mental health section, it looks like a schizophrenic's brain right now. I've added a lot of stuff, but I have taken away some things that I didn't use as much as I thought I would too. But I think initially when I was setting it up, I spent about $2,000 or so on the initial inventory. And then of course you're going to recoup that slowly over time, but you are continuing to buy more inventory. So that I look at that as just that initial investment in the business.
Yeah. And, there definitely are many reasons as to why to keep overhead low. But I mean, for things like lidocaine, at the time of this recording, there's a shortage in lidocaine. And so I was like, wow, I see lidocaine and I can afford it. I'm going to buy 2 of those because I can't run out of lidocaine. So yeah, that's awesome. And in terms of, as you mentioned before, you are sadly in the minority when it comes to people who are looking for gender affirming care. And in your area, you provide PrEP as well as when you were researching gender affirming hormone therapy as well as PrEP. What resources did you use that other people could look to? Because like I use UCSF quite frequently for care recommendations, but what were your resources?
Yep. So I read through the UCSF guidelines as well. The Endocrine Society guidelines are kind of that's like my handbook. That's what I always go to as far as hormone management. The transgender physicians Facebook group, I think is what it's called. There's a ton of great information on there, and just so many knowledgeable physicians who are willing to help with any specific questions, because the topic can get fairly complex, and I'm not a specialist in that area. So sometimes my patients will have questions about certain things, like, hey, some of the other girls are getting X, Y, or Z hormone from somewhere else. What do you think about that? And I'm like, I don't know. I've never heard of it. So let me go talk to some people who know about it, or look up some guidelines. So those are great resources.
And I love that you have the time to do that. I mean, it's such a common thread that people talk about when it comes to being able to work in the DPC model. You have the time to say, I don't know, but I will get back to you. I say that quite frequently on things that I might know a little bit, but I don't know as much as I would like to be able to share, a full scope picture. I mean, today I'm having a talk about CREST syndrome, and it's like, oh yeah, I got to do a little bit more reading as to current treatments for that because I haven't dealt with somebody with CREST syndrome in quite some time. So I love that. And then in terms of when you are, when you're doing PrEP treatment, how is that managed through your practice as well?
So PrEP it's included in membership. So it's, obviously something that I'm going to take care of for anybody who needs it taken care of. We actually work really well with a specialty pharmacy out of the Bronx in New York,
Wow.
Which is a place I've never been, but maybe one day. And they're awesome about getting folks PrEP medications for free, whether they have insurance or not. If they have insurance, then they'll, obviously bill that and they'll work with the insurance companies to get that taken care of. If they don't, then they're great with getting patients set up with the pharmaceutical companies' patient assistance programs, like the Gilead program. So then the patient, all I have to do is send the prescription up to Boca Pharmacy, and they talk with the patient and they send me a little form to sign, and then the patient gets their PrEP delivered to their door. It's super easy and it's very convenient for the patients. And then of course we're also managing their HIV screening and hepatitis screening and watching their renal function, all that good stuff.
That's great. And thank you for mentioning Boca Pharmacy. What has been your biggest challenge so far?
My biggest challenge. So, like I said, in the beginning, the biggest challenge was finding a space. Since then, I haven't had too many challenges. To be honest with you, it's really been smooth. I have an awesome employee who just goes above and beyond in everything she does. I have a wonderful wife at home, like I said, that manages all that stuff at the house. We have been extremely fortunate to have a community who has responded really well to what we're trying to do in our message. And we have super appreciative patients. We have an awesome EMR and billing platform, which is Atlas. So it has really just come together, and we just kept on trucking. And like I said, at some point we'll just look around and go, you know what, this feels like enough. So that'll be it.
When you share that, I want to ask two questions. One is, how did you come to find Marcy, and how did you convince her that, this is the way of the future for patients?
Well, it's funny you ask, because Marcy and I worked together at the urgent care that I was with. And so she was an MA there, and then she was promoted to a trainer position. And so throughout the planning period, my wife and I, we're always talking about things, and I said, well, we need to hire somebody. Wouldn't it? And we both said, wouldn't it be so awesome if we could get Marcy? But I said, I'm not gonna try to snipe her from this other company because they've treated me well. I'm not, I don't feel right going and trying to pull her away from them. And so we weren't really sure what we were going to do. And then I get a text message from Marcy out of the blue that says, "Hey Doc, I heard you were leaving to do your own thing. If you would be willing, I would love to come with you." And my response was, not yes, but hell yes. So at that point, I was like, all right, this is her decision. She's coming. So then I wound up having a bunch of folks from that company that wanted to come along. But I said, look, that position's filled.
That's amazing. And I'm so glad that it's worked out so well for you. That's awesome. And to follow that up, when she came on, did she make any comments about how this model is so different compared to what she's seen in other places in healthcare?
Oh, absolutely. And she still does, like all the time. When she talks to patients on the phone who are calling and have no idea what we are, and they're just looking for a primary care doc, I hear her all the time up there talking to them. And she says, I had no idea what this was before Dr. Adams started it up, but I have been absolutely amazed. And this is the coolest thing I've ever seen. Our patients love it, and I love it. So, yeah, I don't know that she fully understood it before she decided to come on, but she knew that she wasn't super satisfied where she was at, and she thought that we would probably work pretty well together, which obviously we do. And so she wanted to be a part of it.
And have you had any, people to help out when you reach your full panel, other, medical students or residents or other physicians who are interested in joining Auburn?
I haven't had any other physicians interested in employment or anything like that. I do get an occasional call from a pre-med student or something like that who would like to come shadow, and I've done that once or twice. But usually, I feel like I'm letting them down from a medical experience standpoint, because I'm seeing some days I see 3 patients in a day. So it's not a great educational experience for them. And they, at that level, they don't understand what the difference is between what my day looks like and what a fee-for-service day looks like. So they're not really going to get the value at that point, I don't think.
And I hope that when they look back and see all of their rotations, I hope then at least they see the value of a happy doctor and a happy Marcy are very different. And you don't necessarily see that in all fee-for-service practices. So
absolutely. Yeah, you're right.
Now, I asked you about your biggest challenge. I want to ask, what's your biggest win?
I would say my biggest win is when we got to the point to where I said, I looked at the finances and realized that I could quit all other side gigs and I could support my family with just my income from Auburn DPC. Amazing.
I had a physician who was asking about, how do you guys get reimbursed? Because you're not taking insurance. And, the model, when I shared, it's like a gym membership. It's like a Netflix subscription. You have so many people paying that you this much per month, and that equals X amount of dollars minus your overhead, taxes, et cetera. And she's like, oh, that's it. That's really it. Wow. It's so streamlined. And it's like, yes, this is exactly why we get so excited about this as a real way to be able to practice medicine autonomously and be fiscally sound. Or be financially sound. So awesome. And so as we close, I want to share another quote with the audience that you had written. You wrote, "Do I worry about whether my new practice will succeed?" So clearly this was early on in your journey. "Every day I worry about whether my practice will succeed. Direct primary care is a new concept that few people in our area have ever heard of. As with any new idea, it's a risk, but I believe in what we are doing, and it's a risk worth taking. I get to practice medicine the way it should be, the way every bright-eyed new medical student thinks they'll practice. I get to put my patients first, and I've got no one else dictating how that needs to look. I believe that direct primary care is the solution to so much that is broken in our current system, and I'm thrilled to be bringing this new model to our community." So now I want to ask, do you worry now about if your practice will succeed, and how does it feel to be your own boss?
Yeah, I think those worries are gone at this point. My worry now is, when do we stop? And being your own boss is great. I get a lot of questions from people who hear about this practice. Well, are you going to continue to expand? Are you going to hire another doctor? Are you going to bring on a partner? And I'm usually like, no, I don't think so. Because I like just being able to come to work every day, do what I want to do, run my business the way I know it needs to be run, and take care of people the way they need to be taken care of.
Wonderful. And Dr. Adams, just in terms of, you've shared amazing resources so far, the Boca Pharmacy, the Mr. Money Mustache. What other resources would you say people should definitely look into if they're exploring the space about DPC?
Well, again, I'll mention Paul Thomas's book. I think, isn't it called Startup DPC? That was a really comprehensive guide that helped me out a lot. I read that book in the delivery room right before I delivered my third baby. And then I continued to read it in the postpartum room. So that was a great resource. The DPC Docs Facebook group, again, is awesome. I can't say enough about that. So many helpful voices there and tons of guidance. So many experienced DPC docs there that can answer questions about anything involving this whole process. I think that's just about all any doc needs to get this done.
It's incredible though, right? We think about how many, hundreds of thousands, if not millions of dollars were spent to go to medical school. And you just broke it down to, maybe a book here and there and some Facebook posts. This is a different community where, when you need help, there's somebody who can help you. You just have to ask for it. So I encourage people, if they're even thinking about, wow, I should probably learn some more about this. Google your area DPC and see if there's somebody in your area who you can talk to, or go on, the Mapper, the DPC Alliance website. There's listings of physicians who are doing this all over the country. And so on that note, how do people contact you after this podcast?
Anybody that wants to get in touch with me is more than welcome to email me. And my email is dr, as in Dr. dr.adams@auburndpc.com. They can go to my website and do a little message at the bottom of the website if they want to do it that way. But those would probably be the easiest ways to get a hold of me. And I would be more than happy to chat with anybody that's looking to make a DPC practice happen.
Perfect. Thank you so much, Dr. Adams, for joining us today.
Well, you're welcome. Thanks for having me.
Next week, look forward to hearing from Dr. Tiffany Blythe of Blue Lotus Family Medicine in Lee's Summit, Missouri. I hope to meet many of you this week at the HINT Summit. And if you haven't yet registered, but you can make the event, register today at summit.hint.com. And for those of you who are unable to make the HINT Summit but are looking for an in-person networking event, the DPC Summit in Kansas City, Missouri this July 15th through 17th is your next opportunity. Check out the My DPC Story bonus episode about the summit for more details and register at dpcsummit.org. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now as well, as it helps others to find all these DPC stories. And lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC, check out dpcnews.com. Until next week, this is Marielle Concepcion.